Imagine being all alone, having a growing amount of questions that no one seems to be able to answer. This oftentimes is how diabetics feel. Type 1 diabetes is such an intrusive disease that it affects every activity seen as normal by anyone without a disease. From taking a holiday, finding a new job, getting a new insurance, or just getting a new mortgage for a house that you want to buy. Everything is different when you're having diabetes. Most probably, diabetics are some of the biggest data producing patients out there in the healthcare market. We measure pretty much everything, from blood glucose to weight to exercise data, heart rate, food intake, and everything else that is related to our intrusive disease. One of my biggest problems with this immense amount of data that we're producing is that it also raises a lot more questions. What are we going to do with this data? Because eventually it does not mean that more data also means more security. And who am I going to address these questions to? Even my diabetic nurse cannot answer most of the questions that I'm asking her related to the data that I'm producing. Another big problem that we're having right now is also the fragmentation of technology for diabetes patients. There are numerous of apps available for mobile phones and mobile tablets that monitor pretty much everything of a diabetes patient. But they're not working together. They all have their own purpose and are not collaborating, which causes more insecurity and also more questions for patients as well. You would expect that patients retrieve education about managing their disease, which happens, of course, but even on this part, there are certain topics that are not being addressed properly. Like take for instance getting pregnant, or how to get a new life insurance, or what about your job, how to handle stress, what happens when you're having the flu. These are some of the topics that are not being addressed even by the education that diabetics receive right now. Also, this causes a lot of stress among patients. It causes a feeling of being left out alone in an immense amount of data. So how can we solve these problems? How can we make this immense amount of data actually work for diabetic patients? How can we connect patients together so they don't feel left out alone in this massive amount of information? Keep on following me on this channel to find out about the solutions that we're developing for our fellow patients.